Megan LaFollette. She's the executive director of the 3Rs Collaborative, and she leads over 100 volunteers across the globe in advancing 3Rs. She has over a decade of experience in practical animal welfare and 3R solutions. And so she has been instrumental in advancing widespread implementation of evidence-based strategies, and such as refined mouse handling, rat tickling, and culture of care. So, Megan, we are very happy to learn more about experiences and what you can suggest for a good culture of care.
My title is the heart of research, caring for people, caring for animals. But I'm going to go into actually more than just caring for people and caring for animals. Since I'm the very first speaker in this culture of care focused series, I am going to give a pretty good overview of what culture of care really is. So I already had a little bit of an intro. A little bit more about me is my original background is a PhD in animal behavior and welfare. So I really love thinking about animal welfare, lab animal behavior, but I was really focused on implementation and on that human side, really understanding why people do or do not implement important 3Rs changes. And so as I've gone along in my career, I've realized that supporting the people is of the utmost importance, because if people are burnt out, if they don't have extra energy, it's really hard to expect them to make changes. I work at the 3Rs Collaborative, whose mission is to advance better science for both people and animals. Although we're a US-based nonprofit, we do work across the globe to advance the 3Rs. And we really span across lots of different topics. This is all of them on the slide. But of course, today, I'm really just talking about culture of care. This is one of our initiatives that used to be on compassion, fatigue, resiliency. And frankly, we did so much work in this area. We decided that it was time to actually expand and move on to another topic. But I'm here to share with you both about culture of care and compassion, fatigue, resiliency. So to take a step back, we might want to think about what, we already asked this question, what really is a culture of care? In some ways, it might seem self-evident. Oh, it's a culture that cares. But what does that really mean? How do you make that actionable, measurable? How do you know if you're succeeding? And then that also might make you think, well, what is the institutional culture? Some of us might have an idea of what culture means in our country or in a religious sense. There's celebrations, ways of acting, values, etc. But what do we think about culture when it's our workplace? So it's really not that different from just general culture. It's concrete practices, it's beliefs, shared attitudes, and the environment that all occurs in. And ultimately, when we're looking at culture of care, we're looking at 4 specific pillars that support it: scientific integrity, animal welfare, human well-being, and openness and transparency. All of these 4 components should be baked into the culture. And it's only strong when all of these 4 pillars are aligned and reinforcing each other. Every pillar is essential on its own, but it's their interdependence, it's how they all interact together that really forms the foundation of really, really excellent science and responsible stewardship. This is kind of a graphic that actually my program manager, Eliza, created that I think really kind of overviews what we're looking for with a culture of care. So truly no single pillar can sustain it. Focusing only on strong science is not enough, because for strong science, we need humane animal care, supported people, and clear communication. For animal welfare, we need people that are engaged, rigorous research, and good transparency. I'm highlighting this human well-being since that's really the focus on this series, but people are going to feel best when they can trust the systems they work in, when they feel like their institutions truly value that strong science, that good animal welfare, and honesty and transparency. And that transparency is only credible when it's backed up by those high standards as well. And so again, this really forms this coherent and resilient framework. And I like this quote, "A culture of care is not the sum of its parts, it is the strength in their connection." So taking a step back, so we're going to talk about each component individually, but I also want to talk about some key things that make this truly a culture and their interdependence. Importantly, these things don't happen for free. They don't happen for free, and they don't happen without effort. So there needs to be actual resources and leadership from the highest level of management. There needs to be an environment where staff, all sorts of staff, come forward empowered that they can share any suggestions, whether it's on animal research, science, or transparency. There should be mechanisms for good communication and collaborative work. I know the third series in this webinar is specifically about this, which is really important. Good training programs, programs that recognize excellence, empowered oversight bodies, and generally going above and beyond the legal requirements and having this continuous improvement, not being stagnant and saying, well, we're doing good enough, we don't need to do anything else. But let's go into the specific pillars. So I'll start with scientific integrity. So this is really about advancing strong, reproducible, and ethical science. And as I go through each of the pillars today, I'm going to talk a little bit how they truly are connected to a greater culture of care, and then talk about some of their principles. So how does strong science connect? Well, it reduces that animal numbers. It supports better welfare and really thinks about cumulative experiences. It also helps build public trust in the research quality. And then again, I've highlighted the part that relates to the people, that having a really clear design really does reduce the stress and ambiguity for people carrying out the work. The people who are doing this science are going to feel better about it if they can trust that it's translatable, that it's robust, that it's really designed well, because then they don't feel like the animals' lives are wasted in the research. So it's really, really important that we do have that foundation of strong science. Some general core principles: robustness, validity, replicability, reproducibility. I'm going to go high level here. I'm not going to teach you how to fully conduct strong science today, of course, but hopefully I'll give you a few things to think about. And we have a huge, I'll go ahead and mention it, we have a huge culture of care resource hub on our website that has links to further reading, more research about these topics. Again, a few more principles: clear experimental planning, making sure that you're having valid test methods that are not just replicating what has been happened in the past, what we've always done. We want to step back and think, is this valid? Does this actually make sense in my test paradigm? What model I'm selecting is hugely important. There are a number of models out there that just haven't been considered very translatable. We want to move away from those. And making sure that we're using these really important basic things that sometimes get skipped: blinding, randomization, and appropriate controls. Few other principles. This one's really important and I think supports that staff being as well. Animals treated like patients that are in their clinical trials, where they're having that better welfare practices. That's going to help translate to our clinical population. Considering using emerging technologies such as digital biomarkers and more, and purposeful inclusion of biological variability, where we're including both sexes, perhaps multiple strains, diverse age groups, etc. So, like I said, I can't teach you how to fully do strong science today, but there's lots of other tools out there. I'm just listing them on the slide that you can look into. The one that I will highlight is the one that we've designed ourselves. This is our 3R certificate course. It's about a 5-hour virtual training module that provides kind of this comprehensive, in-depth, actionable training. It can be completed kind of at your leisure, and institutions can track their learners. So that, again, is all on our website. I won't go too far into that, but that has much more in depth on all 3Rs and also on the culture of care. Second core principle: animal welfare. This is really about embedding all 3Rs into everyday practice, how it connects to a greater culture of care, kind of gone through the stronger science, that it can reduce variability and distress. This supports staff morale and ethical alignment, really strengthening human well-being. One of my earliest research in this area, we actually found that the more that people felt like their animals had good welfare, that they were providing more enrichment, the less compassion fatigue they had. Even though theoretically that is more work that they're doing more. They're feeling better about it because they feel like I am doing the right thing. This is aligned with what I want to do with my life. Also, again, externally, that's really important. The public cares about how we're treating our animals. So this is a very important pillar. Again, some core principles. We go far more in depth in our 3R certificate course about animal welfare, but we're thinking about both physical and psychological well-being, minimizing stress, and that continuous improvement. And really thinking about the cumulative experience, all of it, from the time that the animal is born, where are we getting it from? How's it being transported? Is it being acclimated? To how it's being housed, just day to day. Do we have space, complexity, choice, social housing, enrichment, positive human interactions? To what we're doing to promote health so that the animals aren't getting sick under our care, having, trained staff, continuity of care, to then the research itself. So having all 3Rs applied, acclimation and habituation. Can we have refinements in procedures, voluntary dosing, microsampling, and then thinking about our humane endpoints and intervention in advance? And then finally, that end of life or transition to adoption, etc. See if adoption or retirement is possible. If you are euthanizing, use either AVMA or whatever your body is, approved methods, and then providing resources. So that's kind of thinking about that whole life experience. But then it's also important to go beyond just compliance. And so some 3 things to consider. Event report recognition and reporting. So really having a mechanism for staff to report any welfare concerns without fear of reprisal. You can't get better if you don't know what's happening in your facility. And if people are afraid of getting, fired, of getting yelled at, etc., they're not going to report. So how do you set that up? Having assessment tools regularly, so you're actually checking, is what you're doing, supporting the welfare of their animals, and then trying to have collaboration between all different bodies so that it's this unified approach. Okay, second to last pillar, I am going to do obviously a deep dive into that human well-being component today, since that is the main theme of the webinar. But I want to go through openness and transparency first. And this is about this clear, honest communication, both within and outside of the research community. So this helps strengthen scientific integrity by making study design and outcomes visible and reproducibility. Clear messaging also empowers and supports staff, reinforcing psychological safety and engagement. Again, one of my earliest pieces of research in this field found that people were most likely to have lower compassion fatigue if they felt like they had someone to talk to about the research that they do and someone who could support them about the work they do. And so if people are told, don't talk about your work, you need to hide it, all of that, they're going to be less likely to do that. And then they're not going to feel supported. And that's a huge, huge risk factor. We're social species just as much as many of our animals are, and we need to lean on others to help us feel better. So having transparency and having these ways to talk about what we do can really help our staff feel more safe. And then finally, this kind of helps identify areas for improvement, and also minimizing risks helps better welfare. A lot of times when we realize, we're going to have to be transparent about what we're doing, that encourages us to raise our standards to say, okay, if we're not comfortable sharing what we're doing outside of our institution, should we be doing it? And is there a way to improve it? So what does this actually look like? So one easy or perhaps easier way to start is what's called inReach, where you work with talking to people who aren't directly involved in the animal research process. So maybe they're in a finance department, or they're an admin, or just, again, they're doing something that helps the business that's not directly in research. Can you do a outreach to them, whether allowing them to shadow teams? Can you invite them to a presentation series? Can you even just have an internal hub that talks about what you do, or an Ask Me Anything forum? After that, or perhaps at the same time, external communications. I have just two screenshots of two organizations who are also members of the 3Rs Collaborative that have external facing websites that talk about what research they're doing. They might have patient perspectives. They may have facility walkthroughs. They're trying to give people really this peek inside of their facilities. Joining an openness agreement can be really helpful in that it gives you really clear steps and commitments that you need to make. Here in the United States, we finally got one launched. We got signers on board. It has these four key principles. And then what's really helpful is they have lots of examples, and then they have a clear, here's the commitment. So communicate clearly, this is what this means, and here are some options for how you can do this. Statements, images, explaining. This is what engaging with public audiences actually looks like, and it gives you options. So these openness agreements can be a really good template for you to follow. Last, but certainly not least, is human well-being. We need to support our people, their resilience, their safety, and engagement for any of this else to work, because we need people to do good science. We need people to make better animal welfare, and we need people to help support those openness and transparency. And so if we don't have those people, and those people don't feel supported, they don't feel like they have the time, the mental energy for these things, everything falls apart. So it's so important. And again, this is how this connects to it. Yeah, if you have a supported team, they're going to have more care, more precision, less mistakes. They're going to be more engaged with welfare and data quality. They're going to have less burnout and less stress. You're going to have less turnover, so you can train really good people. And again, that open communication that really encourages feedback and drives continuous improvement. And again, before I jump in, I just want you guys to look again at this kind of culture of care diagram. These are all important. These all interconnect, and that is what makes culture of care strong. Just a sip of my coffee. It's just after 8 a.m. Here in Denver, Colorado. Also, this is the Maroon Bells in Colorado. Totally unrelated aside, but it's one of the most beautiful places in Colorado, I think. And now I'm going to jump into kind of the bulk of the talk, and that's about why, and really thinking about why working in animal research can be both uniquely rewarding and also very challenging. So most of us got in this field because we're interested in answering questions, solving problems, and ultimately helping people and animals. A lot of us really care a lot. And I want you to think about what brought you here, what brought you here today. And we can experience this deep sense of meaning and compassion, satisfaction, contributing to these scientific advancements. We found that there's two sides to this. There's a lot of satisfaction in what we do and feeling really positive about that. And that gives partially because it can be so rewarding. When we form our bonds with our animals and we improve their lives, it can feel so good to say, I really helped that animal today. I helped many animals today by pushing through this change, etc. And that can be this really, really positive part of the work that we do. But it can also be really challenging. Because of the science we're doing, we may have to design, approve, perform, or view stressful or painful procedures. And that might be necessary in order to study the scientific phenomenon and answer the scientific question that we have. This can lead to what is sometimes called perpetration-induced traumatic stress, or PITS. This is the trauma that results from actually causing stress to others, whether human or animals. And then I've actually termed this in our field the caring harming paradox. More broadly in kind of vet med, there's this caring killing paradox, but I actually think in our field it is more hard to cause harm, active stress, and pain to alive animals versus a peaceful death, which is actually can be more positive. And that can be really, really hard. It's very different from almost any other field. There's almost no other field that we're asked to both care for deeply and also cause harm. And because of this, we may experience moral stress and emotional dissonance. What this means is moral stress is when our actions do not match our moral code. Probably most of us have this deep belief that we should not harm animals. And yet, again, in order to conduct this research, in order to get to these answers, we may have to do that in some small way. Emotional dissonance is when our expressed emotions differ from our felt emotions, where we're masking. We're not telling other people how much we're feeling about what we're doing. And these can be really challenging to experience. And ultimately, even though we may experience great reward with our animal bonds, most of them are broken. And this can lead to what's called disenfranchised grief. This is a type of grief where we typically don't get a lot of empathy from our friends or society. We may not get organizational support, and we may even get disrespect. Oh, it's just a mouse, it's just a rat, it's just your job. Why are you so upset? And people just don't understand why doing this can be so hard. And that, again, that's unique, whereas, doctors, nurses, people working in maybe human healthcare, it makes sense, like people really empathize with that, and they often may have more support. And so ultimately, caring for staff is about promoting a good professional quality of life. There's lots of ways to think about professional quality of life. I really like this scale and just have been working with it for a while that divides it into two components: compassion fatigue and compassion satisfaction. Compassion satisfaction, this is that value and meaning, knowing that we're doing something positive. Compassion fatigue is that burnout, that emotional exhaustion, anger, frustration. And then there's secondary traumatic stress, which is kind of similar to PTSD, where maybe we're having hypervigilance, nightmares, avoidance, where we're avoiding things related to our work. So those are the definitions. That's kind of the two pieces. That's a bit of background. Now, how do we actually support human well-being in our workplace? Well, luckily, we have so many resources at the 3 R's Collaborative, completely free and accessible on our website. We've created a whole how to set up a committee at your institution. We have posters you can hang. We have a webinar series. We have group activities. We have passive learning. We have a survey we can conduct. We have so much out there for you, and we lay it out very clearly on our website. You also, and I'll just go through a few of these principles that are really important. One is promoting positive workplace connection and value across different teams. I mentioned this earlier, how important it is for people to feel like they can talk to others and feel supported. Some ways that this can look like and that you can kind of orchestrate this is having, say, science talks from the researchers. Sorry, my timing is going on. I'm gonna really quickly, sorry for this pause, but this timing thing's driving me crazy. I'm gonna turn off my clear timings on all slides, and I will be back with you in just a jiffy. Amazing. Thanks for the interruption. Sometimes the timings just pop on up. Anyway, so this is really, really important. Like I said earlier, just like our animals, we are a social species. So we need to feel connected, and we need to feel valued both within our teams and across our teams. What that looks like is science talks from researchers to animal care teams. Can we have boards that we're introducing different staff? having recognition for respectful good behavior, as well as accountability for disrespectful behavior. We also want to support and model a healthy work-life balance. This is very important. You can't just say, oh yeah, we care about this, we value it, but you actually need to have policies in place to support it, and leadership needs to model this. Because if you say, oh yeah, we support you taking time off, and then the highest level of leadership never do it, staff aren't going to feel like they actually can. And having time away from work can be a really healthy way to cope. I mentioned this earlier with the animal welfare, but having a way to have anonymous feedback from staff, and importantly, actually implement it. I learned this very early on, but kind of the worst thing you can do is take feedback from your staff and then do nothing with it. And then staff just feel like, okay, what's the point? They said they wanted this, I gave them some feedback, and then they didn't do anything. You may not be able to implement it, but at least tell your staff why or why not you may or may not be able to do it. Managers are so important to your culture. Any type of leadership are so important to their culture. So providing them with appropriate training on how to do their jobs better, making sure they're not so overloaded that they can't do them well, that they are knowing that they're monitoring their staff for workload, their staff for wellness, they're having these one-on-ones, really supports that positive culture. And we think this is so important that we have an entire training packet just for managers on our website. Providing staff with growth and development opportunities, again, this really promotes this sense of meaning, this sense of accomplishment, this sense of forward growth, where again, lots of people, we want to feel like we're moving forward in our lives, that we're making a difference. And so this might look like having access to continuing education. Do you have growth paths? Can you have mentorship? Similarly, having a staff appreciation can be really positive. Can you have an employee of the month, some sort of recognition week, a kudos boards where staff are able to thank each other? We want to not just do good work and feel good of ourselves, we want to be recognized. A lot of people want to have some sort of external validation that what they're doing is really making a difference and really feel positive about the work that they're doing. As much as possible, again, we are human primates. And just like in our animals, if you've learned anything about animal welfare, as much as choice and control as we can give to our animals, the better. Same for us. We want to have some autonomy and control in our lives. What does this actually look like? There's work that has to be done. But is there a way where at least some of the time you can let staff either opt in or opt out of euthanasia? Some people really want to be there for the last moments. Some do not. Is there a way to help flex that? Can you have flexible scheduling, task rotation, providing animal enrichment and having some control over that, and allowing people to select what continuing education they're doing? Not just, okay, we offer one thing for you and that's all you get, but can they select based on their interests? Now, that's those big various things that we can do to support our staff, as well as some background of why this field can both be so rewarding as well as so challenging. Now, just pretty briefly, I'm going to go through some of the results from 2 recent publications that really indicate the importance of culture to human well-being. We, as a team, with my former program manager, Lauren Young, got some grants to actually look at what it would happen if we established a compassion fatigue resiliency program across 6 different institutions. And we did 2 publications came out of this work. One was this baseline data on how we saw that professional quality of life was linked to retention as well as job satisfaction. That's this result right here. This one's super important. This helps kind of provide rationale to our upper leadership, to our management of why they should support this, because it's expensive to hire. It's time intensive. We don't want to have turnover. And so if we can support our people and have less turnover, that's very good. And then the second survey we actually just got the second publication, this is this 2-year data. This is our longitudinal data about what we actually found across 2 different years. And I'm going to go through, again, just really briefly, a few of the results. So the first is we asked participants what most impacted their compassion fatigue. And this was an open-ended question. They could just write as little or as much as they wanted. They could say whatever they wanted. We did not prompt them at all for this. Then we went through and we coded it. And by we, I mean my amazing program manager, Lauren, as well as some volunteers. And what we found was the most important thing was these organizational factors, which I actually think is really organizational culture. By 70% of participants, they mentioned something related to that when talking about their compassion fatigue. After that was things related to the specific research animal job. After that was mental health factors, and after that was compassion fatigue specific factors. So let's dive into a couple of those. I'll just mention the compassion fatigue specific factors. That was things like people wanted training. They wanted more information on this, so having a program was really important. And mental health factors, that's generally just general support for mental health. So making sure that people have access to those resources. But let's go into, this one is these organizational culture factors. What does this actually mean? What do people say? And there were a number of different participants in this. I think we had about 200. And what did people actually say? So first is that work-life balance. I emphasize this because it is important. So people who said vacations, mental health days, and coworkers who are willing to do some more stressful tasks when we're feeling burnt out. That really supports people's mental health. Receiving recognition, understanding, and help from higher ups in the department. Being heard when concerns are expressed to leadership and researchers. And working alongside like-minded individuals that have the same care for animals as I do. And when we actually found this result, we felt that this was really positive because there's some things about animal research that we cannot change, that we do have to, go through some paradigms and cause some stress to animals. And there are going to be challenges. And that is part of working in animal research and science. These things are changeable. These things you can change. It may not be easy, but it is something that that is not integral. This spans across no matter what workplace you're in. And some of these are somewhat easy to change. Some of them are harder to change, but they are very important. Secondly, was this animal research factors piece. So euthanasia, animal welfare, and translational research. So people said either being part of the final goodbye helps me, as I know it was done with the utmost respect, or people taking turns with euthanasia to lessen that emotional impact. Reminding myself of the good that comes from performing well-designed research. So that strong scientific integrity, that's coming out in our survey. Giving the animals extra enrichment, observing animals cuddling, knowing that they're making the world a better place and their sacrifice is done in the most humane way possible, knowing I've provided their care to the best of my ability. Again, these are all things that are part of that strong science pillar, as well as the animal welfare pillar of culture of care. These do matter to how people feel about the work that they're doing. Final result that I'm going to present, and there's a lot of results. Again, I mentioned briefly the retention and professional quality of life. This is our most recent one that we published. That was really positive. And basically what we found is that from baseline to year 2, people increase their understanding and implementation of strategies for combating compassion fatigue. This was actually, I think, one of the poll questions a little bit. And so what you can see here is we have the baseline on top, year 2 on bottom. So this is about understanding what strategies are out there. before in our baseline data, we still had a somewhat significant portion of people that didn't even really know what they could do to help with their compassion fatigue. And at the end of the project, the vast majority of people did know things that they could do to help with them. And then in terms of, okay, you know what you can do. Do you actually do it? Is there actually, are there ways that you're working on it that are could be independent, could be supported by your institution? Again, the majority of people were either neutral or disagreed that they were actually implementing anything to help. And after the program, the vast majority of people were actually implementing strategies. So again, really encourage you that if you are interested in implementing this on your institution, to go on our website. I'll also put a link in the chat that you can go online, sign up for, or yeah, not sign up, but go online and actually access those questions. And then kind of last slide for today, I might end a little bit early. And this is a link to our Culture of Care Hub that you can access 3rc.org/culture of care. Looking at it again, these are the 4 main components: scientific integrity, animal welfare, human well-being, openness and transparency. They all work together. We have some shared values and some frameworks we can follow, and ultimately that makes our institution stronger. And with that, I just want to thank all of the members of the 3Rs Collaborative. They are what support this work. They help make us able to make these free resources for the rest of the scientific community. So I am so, so grateful for them. And then last but not least, if you're not already signed up, I encourage you to sign up for our newsletters for free resources. We promote culture of care on there. We do lots of different things. We give it to you in little bite-sized chunks. And always feel free to email me for more information. Or if you're interested in joining us, thinking about the 3R certificate course, and you need more information, most of it's on our website, but I'm always happy to chat. I'm always happy to hear from you. And with that, I just thank you for the time and thanks for attending today. And thank you everyone for all that you already do to support your culture of care, to support your animals, to support strong science. I know that if you're listening to this webinar today, you're someone who cares, and thank you.